If you're watching this video by now, you've heard about the CEO of United Healthcare being murdered in cold blood in plain daylight out in the open. I believe New York, is it Manhattan? Don't quote. I think it is. It might be. I think that's the city I heard. But shot in cold blood. Right? You saw the suspect, the killer, if you will. He has a pistol with a suppressor on it right in broad daylight, right? Just is calculated, obviously premeditated, thought out. This individual had some information. He knew this person's going to be there. Shot him in the back. Shot him more than once, evidently. And yeah, the bullet casings said deny, defend, depose. And there's actually a book about how insurance companies have these strategies to deny people their claims because it's profit driven. The loyalty is to the shareholders, the people who own stock or shares in these companies. It's profit driven. So, what I want to get into in this issue is a few things. And right off the bat, a couple things I'm going to talk about is something I've said for a very long time before this tragic situation happened with the murder of the CEO of United Healthcare, is that your health, that's right, your health, my health, every individual in the United States of America, your health is leveraged against you. That's right. This in part or in a context fact that you will age, even for a person who takes good care of themselves, such as myself. I'm very healthy and fit at 53, going on 54. Even so, of my situation and other people's situation who are doing everything right the best they can, you eventually will get older, right? So you're going to age, and there can be some issues as a result of that with regards to your health, and to the extent you will need to engage the healthcare system. What about people who are just in accidents? You become injured, traumatic injuries, right? A car accident, you get the idea. So what I'm talking about here when I say your health is leveraged against you, I can't think of too many other countries, perhaps we're the only one, or the main or the biggest one, to where if something happens to you, you get cancer, you're in an accident with traumatic injuries, some other issue, a congenital issue you're born with, right? Other situations, people who get late adult onset diabetes too, and there's a whole other conversation about modifiable preventable risk factors. It's a whole other side issue, but nonetheless, the fact that these things can happen, does our healthcare system, the rules and regulations, our government, and how they use this vehicle, if you will, the healthcare system, is it being used in a way to support people to alleviate suffering? You can talk about the treatment model. Do we treat symptoms or we treat underlying causes? Do we promote lifestyle changes, exercise, and a healthy nutritional system, or do we promote symptom management, drugs and medication, etc.? You get the idea. So the thing that happens here is that, from what I've seen throughout my lifetime, is people, yeah, they go into debt. They're held captive by high bills, high premiums, expensive deductibles, and on top of that, having to pay out that monthly payment into an insurance company system, if you will. So HMOs, healthcare management organization, or where it's a PPO, private, more private-based insurance, like through a company, and the differences, you get the idea. So the thing is, um, I can't think of too many other countries based on people who are more international from other countries, immigrants, or people who've lived abroad or come from other countries who come from other countries. That's not the case. It's not what I hear. So if it's the Commonwealth, the UK, Canada, etc., you can make pros and cons arguments. People might say propaganda. I hear that from people who are actually from other countries who have socialized care or a different healthcare system. They talk about how back in the day, at least when they grew up there, that it was something it was good. It wasn't like people were waiting to see doctors or, getting subpar care, etc. So it depends on who you talk to about the quality of a healthcare system. That's the point. So, yeah, if your health crisis, if you will, or ongoing situation, if you have something that's a bit that you have to manage throughout your life, that's a healthcare issue, if it costs you a lot of money and that it's going to undermine your ability to invest, save, or prioritize other things in your life, then it does diminish your power. It diminishes your ability to engage or prioritize other things in your life. It's holding you back, if you will, because you have this stress put upon you financially the fact that you're having to pay these things just for basic stuff for your health, sick with other things. You get the idea. So before I get more into my thoughts and feelings about why I can understand people are making different comments, memes, if you will, about this tragic situation on TikTok, YouTube Reels, perhaps, and other social media platforms, where essentially people are basically putting out reels and memes. To the extent, basically, the message is this: it's a picture of the CEO guy, this individual. Also, there's photo stills of it, of him coming up behind this individual, kind of portraying him in like the Robin Hood light. Like this guy is really a hero, right? That he's made this statement against the sticking it to the man or the machine, right? So he's kind of like a looking at him like a Robin Hood figure. My empathy is out of network, right? Or my sympathy is out of network, etc. Just little taking little jabs like that. Individuals saying that this individual, if you've seen him, no, you haven't, right? Wink, wink. Like in other words, help this guy. Don't let him be caught. So I'm going to talk more about this here more in the video about, well, I understand why people can feel the way they do versus the issue is it right just to kill somebody in cold blood. So that's a whole other issue I'm going to get into. But right now, I want to talk about what I said earlier. Your health is being leveraged against you. There's a lot of reasons why I've worked out throughout my life, strength and conditioning, cardiovascular training to stay fit and strong. And there's different reasons why we do this throughout our life. If I'm being honest, a lot of it as a teenager was for athletics, football, track and field. Strength training, working out helped me perform physically better for sports. But then it evolved as I got out of high school. Like, hey, it helps me to look better. So confidence, going out when you're single, meeting like romantic relationships. So being physically fit and aesthetically looking better, yeah, you feel more confident. Now it can help you get better results too. So there are reasons for that. There's a lot of reasons when you're younger why we work out. But then as you start getting older, you start internalizing the value of exercise, self-care, take care of your health, your body, that it's about other things, about feeling good, having energy, prioritize your sleep, your physical health, mental health. You start realizing the value of time, that we're not here forever. So then you start to say, wait a minute, exercise, my physical health, that my health is actually my wealth. That's not nothing new. Health is your first wealth. It is. Start to add to how you internalize the value of your health, that it's about your longevity, quality of life, but also your independence and your freedom. So one of the reasons I continue to work out and take good care of my health is I don't want to be vulnerable to the machine that is the healthcare system, that if you end up having problems, it's going to get stuck to you. I don't care if you have good insurance or not. You're going to end up, you can possibly go into debt. It's going to become a liability. It's going to undermine your ability to do other things, and you become more vulnerable. You become more vulnerable, if you will, as far as the financial stress of becoming sick. So one of the reasons, in addition to the many other ones too, is that it makes sense to exercise, work out, eat healthy, have a balance with nutrition, take care of all of this right here, because I don't want to freaking be stuck by get stuck to me by the healthcare system that's going to screw me financially because it's expensive for certain things. I don't want to have to be at the mercy of a healthcare system where people go into debt, or your claims are denied, right? Are you kidding me? So to be fair, I also want to say this. We prioritize different things in life. Everybody does, as a function of where we place value. Because I want to balance this out to be fair. Now, things like cancer, people have to have congenital things that's not their fault, or even being in a serious automobile accident or other type of accident where you have significant injuries that can rack up a huge hospital bill. Things like that, look, those are things you don't necessarily plan for that happen. And in those situations, that's not an individual's fault, right? It's not their fault. So it's not like you can just blame them for not being intentional to prioritize taking better care of themselves. So what I want to speak to are things that we do have control over, and then issues that pertain to our health. Is it a function because we have a shitty healthcare system, or healthcare is too expensive, or maybe it's more of an issue of where we place value? So a physical to get a physical exam with a doctor once, at least once a year. You can pay cash 120, $150 maybe at the most, at least where I live, for them to physically listen to your heart, check you out, and just kind of physically examine you, if you will. Running some blood work's not too expensive. I can purchase that online for about $260, under $300 for some panels, comprehensive panels, a complete metabolic panel. You can do a CBC, a platelet differential, complete lipid panel, complete male hormone panel. I can get all that blood work done for less than $300, right? So yeah, you can get a physical, pay for blood work at least once a year out of pocket. It's reasonably affordable. And why am I saying that? Because think about what we spend money on other things, recreation, entertainment, anything else that's a non-essential, right? So sometimes with regards to things that are just getting physical checkups, being intentional to run some blood work, take a snapshot, look under the hood, right? How are things going? Those type of things really, we cannot necessarily blame that on healthcare is expensive, because at the end of the day, I'm a middle class guy. I don't make, super large sums of money. I'm middle class. So for me, I'm not uber rich. You get the idea, financially speaking. I consider myself rich though with my health. So I will gladly spend out of my own pocket. I don't give a shit whether the insurance is going to pay for it or not. I will pay the money to run blood work, get a physical exam to at least see what the hell's going on with my body. Absolutely, I'll do that because I see the value in it. That's why. So I know people who will spend thousands of dollars on things they don't need: entertainment, recreation, hobbies, etc. And I'm talking a lot of money. Think about somebody with a fishing boat, rods and reels. We're talking major thousands of dollars for tackle, rods and reels, and a fishing boat, and the money it costs to go fishing. $300 in gas to fill it up. There you go. Never mind the beer you might be drinking too. So there's no excuse to say you can't afford to get a physical and run some freaking blood work at least once a year. It's bullshit, even for a middle class, lower middle class person. So this level of how we interface with the healthcare system and taking some responsibility for our health, yeah, that's on us. That's not a financial issue. That's more of your priorities as a function of where you place value. But to be fair, like I said, well, other things, you're in a car accident, you have serious injuries, you have surgeries, etc., or genital issue, you're born with it. Other things that happen that it's not because you didn't make the effort or you're being irresponsible. It's just like, hey, shit happens sometimes, right? So now you're in a predicament that's unfortunate. So those situations, yeah, I get it. And so in this case, I did my best, and now my health issue is leveraged against me. I feel like I'm under the thumb of the system's holding me down, right? I got all these payments. They're denying the claim, but I still have to pay this expensive deductible before they start to help me. Never mind, my health might be preventing me from even working. So I get it. People feel frustrated. They feel angry. They feel used, they feel exploited, they feel unsupported, they feel unappreciated. They have a sense of injustice when they look at CEOs being paid 10, 20, $30 million a year, living off of the fat of the land or the backs of the people who pay all this money. And you want to hear stories about how they're good people and they're a nice person. Well, shit, I guarantee you, if I'm making 10, 20, $30 million a year, even though part of my job is creating systems that right off the bat deny people health claims, I'm going to feel pretty damn good too. And it's easy to be nice when I got that kind of money coming in. And I imagine my children and wife are probably going to say nice things about how dad's awesome. That's right. But what about the people who are not making 10, 20, 30 million a year? Maybe they're a school teacher, a janitor, heck, even a therapist like me, trying to take care of their families who do not have anywhere near close a cushion like that, who despite that are still good people, who are still nice, treat people with respect, have compassion. And when they help people, it comes at a cost because they're not millionaires. It's a whole other level of helping, by the way. When you help somebody, when it does cost you something to do it because you're not super rich. So it's easier to be the good, nice person when you're on the top of the mountain, right? So just throwing that out there, I understand why people would feel the way they do. I'm not saying it's right to kill somebody, but I do get why people are putting these memes and things and portraying this person as a hero, as a Robin Hood, that this person, wow, he made a statement, right? He made a statement. So there's a lot of mixed thoughts and feelings about this. And once again, I'm not endorsing or saying go kill people. I don't think that's the right way to handle things. There's other ways to protest things and you handle things. You use the, I guess you could say, try to use the legal system, but you know what? Good luck doing that if you don't have no money and you're fighting a powerful machine that has all the money, almost unlimited resources, lobbyists, paying politicians, etc. So that's a whole other conversation. So what are your thoughts and feelings, right? Do you also understand why people feel the way they do? That this person is being portrayed as maybe like a Robin Hood. He's fighting for the underdogs. He's fighting for the people that are forgotten about, right? He's against people who are more powerful, or people who say, yeah, you see him, but no, you didn't, right? What are your thoughts and feelings? Do you think it is understandable? What is justifiable, by the way? You know, within our government, murdering people, you can say kill, but kill, murder, whichever word works for you. Within a context, murder, killing people is sanctioned by the military, by police, depending on what they deem is legally killing somebody. So if you don't pay your taxes and you're staying on the land that you believe is yours and you're not wanting to get off it, yeah, the federal government can put a bullet in you with a rifle from, I don't know, 50 yards away and say, yep, that's justifiable homicide, sanctioned murder, right? Same thing with other contexts, wars, etc. So if a person in their mind, maybe they were the loved one of a family member who was denied health care, who died, who suffered, if you will, feels angry against this machine, if you will. And so they lashed out. In their mind, they felt justified to take this into their hands and they kill this person. In this context, that's illegal. That's right. So this person, they're looking for him. So these are just existential thoughts, purpose and meaning, what the hell's going on. You get the idea. So my name's James Hunter. I make videos about things, mental health, physical health, fitness, wellness, other topics of interest, because why not? If you have an idea, belief, a feeling about this situation with the healthcare system, this CEO that was murdered, please drop a comment below. And if you like content like this and other topics that I mentioned earlier, please subscribe to my channel. I really appreciate it. Thank you and have a good day.